Hello good people, welcome to my YouTube channel. This is a channel that we are going to be talking about common illnesses that affect children while growing up, and we are going to be talking in a language that every mother, every caregiver, every guardian and anyone can understand, so that they can have the know-how and to get the more knowledge on many things affecting our children. So this is JEMIENAFTALY on the pediatric world. Welcome to my channel. So today's topic is about breastfeeding. Very interesting. Why should we talk about breastfeeding? Why is it important? When we say breastfeeding, what are the consequences of not breastfeeding? And what are the contents of the breast milk? Why do we insist on doing the breast milk alone for the first 6 months? What are the good positioning and attachment to the breast? What are the consequences again of not doing all these? And we'll be talking about this and many more here. So just click on the subscription button, subscribe, like, share, and don't forget to leave a comment down there. So stay with me. So breastfeeding. Why insist on breastfeeding? Breastfeeding is the standard milk for all children, and when we talk of breastfeeding for exclusive 6 months, we mean just breast milk and nothing more. We should just give breast milk for the first 6 months without giving anything, even water, no other food, no nothing. So, and after 6 months, you should continue breastfeeding your baby for up to 2 years or beyond. So we are going to see why. And so let's start by maybe knowing the contents of the breast milk. So breast milk contains water, which is 90%. This is where the child should quench their thirst from. And so there's water, there are fats, there are vitamins, and there are also immunological factors. These are the things that make the baby prevent the babies from getting illnesses so easily, because there's those things that they make their immunity to be strong. So after having said the contents of the breast milk, now we can say how long are you supposed to put your baby on one breast? It looks simple, but did you know that you're not supposed to do 2-3 minutes in one breast? It should be longer. And longer, we mean it should be 10 to 15 minutes in one breast. Do you know why? Because when you do 2 minutes, remember we said what comes out first, 90% is water. So imagine breastfeeding for only 2 minutes in one breast. And what happens? Then you change to the other. So the baby will be getting just the water first without having reached the nutrients that we said. We said there are vitamins, there are fats, the immunological factors. So that baby does not benefit from that breast milk. Hence, they don't gain weight. Yes, they don't gain weight. So now, what are the factors? You hear mothers saying they don't have milk. So maybe what are these factors that affect the secretion of the breast milk? First, number one thing is diet. The health of the mother is key here while breastfeeding. So the diet should be a good diet. It should be balanced, meaning when you talk of balanced diet, we mean this mother should be getting carbohydrate, protein, and vitamins, everything, and good drink water, so that because this diet is important to this kid. What is number two factor that affects the milk secretion? Number two factor is emotions, stress. So when you're so stressed up, the milk automatically cuts down and the baby doesn't get anything to breastfeed. So just relax, breastfeed your baby with no stress, with no issues, so that the baby can get what is really required. Another thing that affects the milk production is the drugs. So it's very important for moms while breastfeeding to be keen on the drugs that they use. It may be so necessary, maybe they are under medication. So that's why we say just visit your doctor so that they can give you the right drugs while breastfeeding. There are those drugs that are contraindicated, meaning they're not supposed to be taken because they affect the milk secretion. So talk to your doctor well, and if need be, when you are using them, just it should be on caution. So that's another thing. How much of the milk is produced in our breast? So we say that the milk that is secreted, did you know that our breast secretes around 600 ml of breast milk in yes. So that is it. Another thing, why do we insist on breastfeeding? What are the advantages? We said it is the standard milk. It is the ideal diet for this baby. We said what it contains so that the baby can benefit. It's also convenient. Breastfeeding is economical. It is sterile. So, and when do we breastfeed our babies? We should breastfeed on demand. So there's nothing to say like, somewhere I cannot breastfeed my baby. No, we should breastfeed on demand. Whenever the baby needs that milk is when you should give. Either in the matatu, on the stage, just do your thing. Just breastfeed this baby. So, what are the best positioning? Do you know they are good positioning and attachment methods to the breast so that the baby can get the milk? So first of all, we are going to talk about the positioning. When I say positioning, number one point, the baby's head and the body should be on the line. It should be on the straight line. So that the head and the body should be on the straight line. That is a good positioning. The baby should be held close to the mom's body. It should be like the baby is just so far away. So the baby's head should be held to the mom's body. Another thing, the baby's whole body should be supported to ensure, again, good positioning. Yes, right? And the baby should approach the breast, the nose to the nipple. So those are the best positioning. Now we go to attachment. Good attachment to the breast. What do you mean by saying good attachment to the breast? So you be sure that you have attached your baby well. Whenever the baby opens his mouth wide open, the baby's mouth should be wide open. The lower lip should be rolled outward. That's the best attachment method. And also the areola is the black part of the breast, and the whole areola should be inside the baby's mouth. So the whole of it, most of it, when the child holds the breast, most of it should remain upward and not downward. When you find that the black part of the breast is the one being left downward after the child has held the breast, then no, that's not the good attachment. So the biggest part should be left upward. And we said about the lower lip should be rolled outward. So again, the baby's chin is this part of the face. The baby's chin should touch the breast. So that way you're ensuring that this is a good attachment method. So we said about whole areola being inside the baby's mouth. So we will find that when you give just the nipple, if the baby just gets the nipple without getting the whole areola into the baby's breast, then there are so many problems, so many issues coming towards those, and we are going to see the disadvantages of doing them. So another point, you don't have enough milk. That's another question we ask. When do you know that this baby has gotten enough milk? Number one indicator to show that your child is breastfeeding well is weight gain. Baby should gain weight, and the weight that should be gained, it should be approximately 500 grams per month or 125 grams per week. Did you know that? So interesting. So this way you're able to know that your child is breastfeeding well and they're getting enough milk. Another way of testing, of knowing that your child is getting enough milk, is by the wetness test. It's called the wetness test. This is where you change it is determined by the number of diapers that you change. So the child should pass urine 6 or more times in 24 hours. You knew that? Yes, the baby should pass urine 6 or more hours in 24 hours. So those are the ways that show that your child is really getting enough milk. So when you find all this is not it's not coming, the child is not gaining weight, what are the solutions? So the solutions, we already said that you should have frequent feed 3 hourly. Again, I was asking about I insisted about giving this baby breast milk for in one breast to stay there for around 10 to 15 minutes. So that is it. So what you do, you do frequent feeds and longer duration of feeds. So that's about the 10 and to 15 minutes part. So also ensure proper positioning and attachment. Still a solution. We just talked about the good positioning and attachment. Also good diet. We've insisted on the mother's diet. We've said about balanced diet, and also being free. You should not have the stress, the worries. Those ones we said again, they cut the breast milk. So you should ensure all those. And the drugs we said, not unless it is necessary, you've been advised by your doctor to use them. It should be so cautious, because these drugs, some of them really affect the breast milk, the breast secretion. So if you don't do all this, what are the side effects? What are the dangers? And do you know these dangers? Just before we go to the dangers, first of all, when is the child supposed to start breastfeeding? Immediately after birth. If it's a normal delivery, then this baby should be put to the breast within 30 minutes of delivery. You knew that? Yes. Because of, if not that, we are going out to see the side effects if you don't do so. If it is a cesarean section, then it is understandable. So you can place the baby on the breast within 1 hour of delivery. Yes. So now we go to the side effects, and the problems occur to both the mother and the baby. So those that occur to the mother, if you don't do all those things we have talked about, we call them maternal problems. So number one, we have breast engorgement. The breast engorgement. You have sore nipple. The nipple start cracking. That's why I insisted, if you just give the nipple and you're not giving the whole areola, the whole black part of the breast, so those breasts are going to crack. And if you're here and you've ever experienced that, I'm sure it was not the best experience ever. Cracked nipples, so uncomfortable and very painful. So also we get infections like mastitis if you don't do the best positioning, attachment, diet, everything. It's also a consequence to the mother. They get infections of the breast, the mastitis. They also get the breast abscess. Abscess is when the breast becomes starts having some pus. So we know that this is a breast. It's a pus that forms. So again, this affects the mother. So what are the problems to the baby? These are called neonatal problems. So number one is dehydration. This baby, if not breastfed well, is not getting enough milk, they become dehydrated. So your baby will not, they're just there. And number two thing is jaundice. This is the yellowness of the eyes. And maybe in our next topic, our next thing will be we will be teaching each other about what jaundice it is, what it entails. So these are side effect of not breastfeeding. So there's jaundice. The child fails to grow. They are underweight. So we call this failure to thrive. The child is not gaining weight according to the kgs and the age of the child. So this is if you don't breastfeed the way it is supposed to be fed, if the way they're supposed to be breastfed. So thank you for staying with me. Again, this is a channel that we talk more about children health and the common illnesses they get while growing up, the simple things about children, making people aware, in a language that everybody can understand. We say they're trying to be as layman as possible so that everybody can understand, and the end result is to get healthy babies and have improved the quality of life of our children. So thanks again for staying with me. This is JEMIENAFTALY on the pediatric world. Thank you for watching. Thank you so much.